Fortis Healthcare, India's leading healthcare provider, is growing and growing quickly. But it's not just in India. To tell us more about his company's plans, Malvinder Singh, Fortis' group chairman, joins us on INSEAD Knowledge today at the Global Anthropolis Summit in Singapore. Mr. Singh, thank you for being with us. In the last year, you've set up and expanded your international business, buying a dental chain in Australia, as well as hospital chains in Hong Kong and Vietnam. Why such a focus on international markets when you already have an underserved and potentially huge markets within India?
I think for us, our vision is to be a leading global healthcare services company. So India has been our first market. It is our home market. We've done exceedingly well in India, from really starting from scratch in 2001, and in a relatively short period of 10 years through a very aggressive organic growth, some very aggressive and strong big ticket acquisitions and management of others' healthcare facilities, come to a leadership position in that market. But at the same point in time, I think, for us, we don't want to be limited to being a healthcare player confined to a market. Our vision and our desire is to be a global healthcare player. For us, while today our international business has really evolved over the last 10-12 months, and we've gone from zero in international to having a 50-50 of our global business. So half our business is international, which we've entered 10 markets, we've made 7 acquisitions. It's all happened in a relatively short period of a few months. But having done that, I think if you look at the sheer size of the market, even within the larger Pan-Asia Pacific market, the healthcare market is $500 billion. In India, it's a $50 billion market. So yes, the Indian market will grow at a very rapid rate, but I clearly see a lot more opportunity and a lot more growth happening in international markets. So over a period of time, while the Indian business will grow rapidly and will substantially be much larger in size, the international business will probably be larger.
Are you looking to grow beyond the Asia-Pacific region?
I think at this point in time, for the next many years, the focus is Asia-Pacific.
These 10 markets you've entered are fairly heterogeneous markets. What economies of scale are you trying to achieve across geographies?
There is capability, there is knowledge sitting in each of these various verticals, which have their centers of excellence or their leadership in terms of, in each of these businesses, they're sitting in different markets. So you want to have the ability to leverage that understanding, that knowledge, that capability, and cross-fertilize it into multiple markets. At the same point in time, my focus of getting into multiple markets in different healthcare verticals was driven by the opportunity in that market and what was a right entry strategy. So for example, when we entered Hong Kong, we entered through the primary healthcare business. So we did 2 things by entering Hong Kong. One, you entered a very important market for the future. Second, you acquired tremendous capability in an area within healthcare which was new to us as a business. So we got that knowledge, that experience, that skill set, the management team sitting there. And then we will, on the one hand, build in Hong Kong from primary healthcare to daycare specialty to radiology to pathology, and then eventually into a greenfield tertiary healthcare facility, and yet use that primary healthcare knowledge to take it into multiple markets. So if we were to start afresh from scratch in a market in primary healthcare, our learning and the time that we would have taken would be a lot more.
With the consolidation of your Indian and international operations, you're looking at about $1 billion in revenues. What are your investment plans?
I think there's going to be a huge amount of investment in existing markets where we are present, and also for entering newer markets. And it will be a mix of organic and inorganic opportunity. So for me, M&A is an integral part of our growth strategy. In markets where we've invested already, we will continue to build on that and strengthen our existing positions and get into newer verticals within existing markets, yet at the same time look for bolt-on opportunities for acquisitions, and also look at acquisitions for entering newer markets.
Given the economic slowdown, is this a good time for new acquisitions, or is healthcare pretty recession-proof?
For healthcare, it's really recession-proof. And I think there is a huge demand-supply gap sitting in healthcare across Asia. from a demand supply perspective, and therefore there is a substantial need for investment in healthcare facilities, whether it's from the private side or the public side or through a PPP model.
The lack of medical infrastructure has often been cited as a major problem in emerging economies. So what needs to happen for a country like India to grow its healthcare sector?
I think there is a clear need for creating a new business model, for leveraging technology in a different way, in a new way, to be able to reach out, to diagnose a patient, to provide consultation and treatment, and then for you to be able to monitor the progress that a patient has. So to an extent, you do need a hub and spoke model, but beyond that, I think technology will play a critical role, and innovative business models will play an important role of how do you reach out in a much deeper manner within the Indian market to be able to provide adequate healthcare to everybody.
What's your outlook for the healthcare sector in Asia? How do you see it evolving with new players, new providers, insurance companies, and so on?
I think there is a huge unmet need. There is tremendous opportunity for investment, for creating additional infrastructure, for providing additional services, for being able to have a lot more talent on the medical and the management side sitting there to run and man these facilities and these businesses, and a much larger percentage of the population that will have the means to, in order to get access to high quality affordable healthcare. In some markets it's driven by personal spending, some is through insurance, some is through government, some is through copay. So it would really vary from market to market. But today people have a lot more purchasing power than they did, and they will have a lot more in the future because all these economies, the GDPs are growing, people are doing well, there's a lot more disposable income sitting there, there's a desire for better healthcare facilities, there is an aging population, there are more chronic diseases. So in every which way you look at it, there will be more demand for healthcare.
Mr. Singh, thank you for joining us on INSEAD Knowledge today.
Thank you.